Hi there, it's Kathy Gates and Melissa Hines from the Institute for Pelvic Health.
And you're watching Demystifying the Pelvic Floor, weekly videos providing real and simplified pelvic floor education for your real clinical situations. We've got you covered.
And today we're going to talk about Kathy's personal experience about how she just thinks a little bit about the pelvic floor in her visits at the health center. So Kathy, let's run through a patient and how you would start to think about the pelvic floor and incorporate some assessment tools into your 15-20 minute visit.
Absolutely. I'd be delighted. So I saw a 38-year-old G2P2 female who was struggling with constipation. Super common. We see that one all the time, especially in primary care. And I opened the door and first thing I did was I looked at the way she was sitting on the chair, right? And she was sitting super hunched over. So I was like, and I'm already thinking to myself, oh, wow, the external pelvis is in a posterior tilt, not good for her pelvic floor muscles. So I'm just immediately watching her sitting, gathering that information. She's hunched over. It's hard for her to really take a nice diaphragmatic breath.
And let's quickly run through why that position is not good for the pelvic floor muscles.
Totally, excellent question. Because when you're in a posterior pelvic tilt, the pelvic floor muscles shorten. So she's basically, however long she's in that seated position, those muscles are contracting, and that is not helpful for her. So as we're chatting, I then ask her to stand up, and I take my hands and I put them, just like that kind of shape, and I go right in on the top of each, I ask permission, and I go right in on the top of each iliac crest. And again, I'm looking at the external pelvis, and I'm looking to see, are my hands equal? So is the right iliac crest and the left iliac crest, are they equal? And if they're not, I'm thinking, I know that is contributing to probably whatever's happening in her pelvic floor. So that's all within the first 60 to 90 seconds of when I walk into the room. So it's not adding anything. I'm just looking at things a slightly different way. Mm-hmm. As she's standing up, I'm also looking at the curve on her lumbar spine. And I also noticed that she was very lordotic. So extremely, very large curve. And I'm thinking, and so all of those things, if I'm using my pelvic floor lens, I'm thinking, wow, her pelvic floor muscles are having to work so hard while she sits and while she stands, right? Because I've certainly learned this from you, Melissa, and learn this with all of my patients, that as there's dysfunction or there's imbalance on the outside, there's compensatory mechanisms on the inside. And most likely those pelvic floor muscles are probably overworking a lot. Mm-hmm. So she's there for constipation. I introduce the idea, I show her the Bristol stool chart. She's Bristol 1. She's like, and she goes like every 3 or 4 days. And, she's like those little pebble ball like stool, and she has pain when she's pooping and afterwards. So I'm like,
And is she on some sort of stool softener already?
No, she's not. Excellent question. So I'm also asking what medication she's taking, including any kind of over-the-counter like natural or herbal supplements or anything like that. Yeah. So I'm already thinking, and so, I pull up a picture on my laptop of the pelvis and the pelvic floor. And I say, your pelvic floor muscles are responsible they support your urinary, bowel, and sexual health. And while I'm doing that, I'm like, oh, and like, talk to me about your urinary stream and talk to me about your frequency and urgency. And do you have any urinary complaints? And, because you're both sort of looking at the laptop together, you're looking at the screen, it's a really nice way to ask about a little bit even more about bowel, urinary, and then sexual function. And it takes it less from that, like, she's in front of me and we're really side by side looking at the laptop and looking at the picture of the pelvic floor, which is super nice.
Mhm.
So, so all of this is happening, it's all super fluid. And then I say, a lot of a lot of constipation can be related to some dysfunction of the pelvic floor muscles. We've already looked at those together on Google Images. And so then I ask her permission to do a pelvic exam. And what I find is that one of those muscles, that pubococcygeus, is particularly tight. So, I'm doing my bimanual exam. I go in and I'm, palpating until you can see the white of the nail bed. And it's like she just about jumps off the table. And so, that's a trigger point, right? And she's got multiple on both sides. And I should say that before I did my bimanual exam, I ask her to Valsalva and I look at the perineum. Super interesting, right? And for her, I don't see any movement at all. I see actually the opposite. And I see like the perineum just going like, beep, like that. And I'm like, oh dear, right? So that's telling me when she's trying to have a bowel movement, the mind body connection is that she's contracting her pelvic floor muscles.
Because you should see that it lengthens if she's doing it correctly. The perineum lengthens,
Totally.
not the opposite or shortens.
Yeah, exactly. So, I discuss my findings with her while she's on the table while I'm doing the external exam and looking at her valsalvaing. While we're just chatting, I'm also looking at her breathing, and I'm looking at her breathing and sitting and standing as well. It's, when you see her lying down, you can really see, like, the big thing. Do you see the abdomen rise, or do you see it's like all in her upper chest and in her shoulders? So, not a big surprise, she's not able to really engage her diaphragm. And we know that when people can engage their diaphragm, when the diaphragm drops down, those pelvic floor muscles lengthen and soften a little bit. So already I'm like, oh my gosh, I can totally help this lady, right? And this is all before, you know, Metamucil or Miralax or Colace or anything like that, right? I mean, I'm all for that when it's appropriate. So I explain everything to her, and we talk a lot about her homework. For me, and she's going to come back and see me in 2 weeks, is she's going to do 10 diaphragmatic breaths every day. She's going to create her own sort of DIY squatty potty, where she is just making sure that her knees are higher than her hips. Because what do we know, Melissa, about when the knees are higher than the hips?
That it relaxes the pelvic floor, it lengthens it.
Totally. So whether or not I just said this is the best position for you. That's exactly what I said. It's going to help your pelvic floor to soften. It's going to make it a lot easier for you to poop. Try it. Just anyway. And so she had a very concrete plan. She was going to do the diaphragmatic breathing, and she was going to create her own squatty potty. And then she was going to come back and see me. I haven't seen her yet, so I'm not sure where we are, but I will report back. And so that it took me 20 minutes.
Yeah, it's quick. And I like how you are looking at her posture, alignment, seated, standing while you're chatting with her, and just kind of taking notes in your head of what that could be telling you, because that's key for an assessment tool for any pelvic floor issue. All right, and that's a wrap. Did you like this video? If so, hit like and subscribe. Please share with your colleagues and comment below to let us know how you may incorporate some of these pelvic floor assessment tools into your exam.
And subscribe to our email list at instituteforpelvichealth.com to get your free guide, 4 tips for managing your challenging pelvic exam.
When you get your free guide, you'll also get access to our weekly newsletter. It's full of real pelvic health education you can use with your very next patient. And we're thrilled to announce our AANP accredited online course is now open for enrollment. You can see the link below to enroll.
Our AANP accredited online course, Beyond the Kegel, is 6 modules packed with practical information that you most likely didn't get in your training and that you can use in clinic tomorrow. You'll get videos, templates. I actually gave the patient that we talked about, I gave her the toileting position handout in Spanish. I was super excited. Hands-on demos, everything you need to confidently help your patients with pelvic floor dysfunction. Sign up for Beyond the Kegel to improve patient outcomes in your provider experience.
Thanks for watching and spreading the word. Let's revolutionize pelvic health, and we'll see you soon.